Hey, everybody, this is Chris
and Kathy
from Petability Podcast. We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to Petability Podcast through your favorite streaming app. Subscribe to our YouTube channel at Petability Podcast and share our content on social media.
You can also support the show by making a donation. Simply go to our website at petabilitypodcast.buzzsprout.com and click on the heart symbol at the top of the page. Thanks for listening.
We hope you enjoy the show. Welcome to Petability. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives. Hey, Kathy, how are you today?
I'm wonderful, Chris. How are you doing today?
I'm great. What's going on?
Oh, Chris, I've got to give you an update on this. Remember my squirrel from our last conversation?
Squirrely?
Well, I changed his name from Squirrely to Steve because everybody made fun of me because they thought Squirrely wasn't, personal.
Steve's much better. Yeah.
So Steve, I caught him burying acorns in the yard the other day in the grass, which I don't think is what they're supposed to do. I think it's supposed to go in the ground. He's trying to use the grass as coverage, right? I'm a little worried about him. I'm a little worried I can't.
So he's not burying them deep enough.
No, he's not even buried. He's in the grass.
It's a shallow grave.
Yes. He's just trying to use the grass to cover it up. So, I put the planter out for him so he can plant his, chestnuts and his acorns in my planter. And I put a little roof over it so the blue jays can't get into it. So hopefully, it's really a whole freaking shanty town out there is what's happening. The shanty town for Steve.
I was going to say a shanty town for squirrels.
It's a shanty town for squirrels. And then I think, and I didn't tell you this the last time because I sent you a picture of Steve, right?
Mm-hmm.
Steve might have a Stephanie over. I'm not sure.
Oh,
I know. I'll keep you posted.
Okay. Sounds good.
Anyway, that's what's up with Steve. So what have we got today, Chris? What's going to be?
I think we should talk about pain. And I know that's not always maybe the most enticing subject, but I think it's an important subject to help our listeners know if and when their pets are experiencing any pain. What do you think?
I think that this is a very worthy topic because I would tell you that I would say that pain or quality of life pain is probably the most important thing to owners. Owners always want to make sure that their dogs are having good quality of life. They also want to make sure that they're able to recognize pain or address pain if their dogs are having it. So I would say that this is a very important topic for owners.
And to your point, pain impacts quality of life.
Yeah.
So I think that's why our owners are concerned because ultimately we all want the best quality of lives for our pets.
Right. And so when I was thinking about that, I thought, I'm going to look up the definition of pain, right? We all know what pain is. We've all experienced pain, right? We've all experienced pain. We know what it is. But I wanted to see what was the official definition of pain because that intrigued me. And so pain is defined as a unpleasant sensory and emotional experience associated with actual or potential tissue damage. And I thought this was a really powerful statement because it recognizes pain as not only a physical experience, but an emotional experience as well. And I think that affects animals as well. I think that they can, and not emotional pain like Steve and Stephanie broke up. They're not, it's not that kind of emotional pain.
Right.
It's think about how acute pain affects you emotionally or chronic pain, how that affects you long-term emotionally. So I thought it was a really powerful statement. They incorporated that it's an emotional experience as well as a physical experience.
That's fascinating. I had a recent discussion with a former classmate of mine from physical therapy school, and she is specifically seeking continuing education and specialization in managing pain for people. And we were talking about it, and I think one of the biggest things is how we respond to the stimuli. So a lot of her job is coaching folks to not have that extreme emotional experience in response to the stimulus. So understand what the stimulus is. It may or may not be noxious, but if we're talking about pain, they're perceiving it as something unpleasant, but not going out of control and off the rails. I think that we can do a lot about that with our pets too, because if we, and how we respond to how they may be reacting and so forth. Mm. So, pain is something that can be managed. We deal with it. It's, I don't necessarily think that coddling is the way to go, but, how can you best manage it and keep your pets functional and having that quality of life?
Right. I think the other thing that's difficult for clients is, or the biggest question I get from us is, how do I recognize pain in my dog, right? And that's a totally legitimate question because, we're all familiar with if we accidentally step on our dog, you're doing the dishes and you step on your dog's foot and then, and then that's when I throw in the emotional piece. Oh my God, I'm so sorry. That's when I throw in my emotional piece.
Right.
That's my emotional piece. But it's not always like that. Sometimes pain is not recognizable as a verbal cue or a crying or a yelping. Yes, certainly those are cues, but what else can we look at for dogs that may be an indication that our dogs are having pain?
I agree. And I think that that is more of a response to an acute pain when they yelp or cry out. Dogs as pack animals and, other pets as well, as a means of survival, they did not necessarily let on that they were uncomfortable or couldn't keep up with the pack or the herd or whatever it may be. So I think that our animals are very adept at hiding these signs of pain or discomfort. So yeah, let's help our listeners to maybe recognize some of the things that may be indicative of pain. One thing that I think of is that pinched face look, that grimace.
Yeah, me too. That's probably the first thing I think of too. I always, I think facial expressions are a really good indicator of pain. And much like you and I might make a face when we have pain, dogs will do that in a similar fashion. And I can't tell you how many times an owner has described to me that their dog doesn't look right? It just doesn't look right. And I don't think that should be overlooked when clients say, my dog doesn't look right. And maybe you don't see it, but they do. It should never be discounted. And it's no small coincidence that your dog is acutely aware, right, of how you respond to their behaviors, because they've spent countless hours sort of watching us and how we respond to their behaviors. So there's no small coincidence that you are very familiar with your dog's facial expressions, right? And if that dog has that scrunched up face, that grimace, that is something that we should report to our veterinarians. That's not a normal face for your dog.
Exactly. And I think also that empty stare too.
Right.
Yeah.
Yes. The vacant stare is also, and those dogs that have vacant stares often kind of like, they have vacant stares and they oftentimes almost look like they're half sleepy, or maybe they'll vacant stare and they'll sort of maybe at some point sort of partially close those eyelids. And maybe in part, that may also be in part that they may be sleepy because if they have chronic pain, maybe they can't get good rest. But that vacant stare is really also something that's important to report to your veterinarian. Also,
I was just going to say that could be maybe indicative of some dissociation, right?
Right.
So they're actually kind of mentally checked out, leaving their bodies and thus leaving that pain behind.
Yep. And then I think the other one that's probably more common in that is maybe a dog that is historically not a dog that is grumpy or cranky, but becomes cranky or maybe even becomes outwardly aggressive. We had a dog many years ago, a wonderful, wonderful dog who came in with a large wound on his leg. So it was deep. It was all the way down to the bone. Now this dog came in with his face just scrunched up, ears flat down on his head. His pupils were dilated. He's panting. His tongue was out. He looked painful, but he was also being outwardly aggressive towards staff, which is not normal for this dog. But this dog is letting you know, I'm painful. I don't want to be touched. Don't touch me. Now that same dog a couple weeks later on suture removal came in with the soft eyes and the soft ears and his tongue hanging out like a goofball. That's the kind of dog he really is. Soliciting affection, right? Wagging his tail and licking everyone's face. So that was a really dramatic change for this dog. So to have him come in like that and be outwardly aggressive like that, I mean, it was also obvious that we could see the wound, but that aggression, not normal for him. The baseline was more like on suture removal when he came in and was like, oh, hey, everyone. Sorry about that sorry about that whole business last week, but that was his normal baseline.
Right. And that, is a pretty extreme change in behavior. But I think that even within that, there's a whole spectrum of, shades of gray. So it could be, that, maybe they are going away from you when normally they would be willing to be petted and so forth. They're hopping off the couch. They're like, really don't, bother me. And I think oftentimes we attribute it to other things, maybe, oh, well, they're hot or they're, whatever, or, oh, well, so-and-so's, in a bad mood today. But what is the underlying cause of that, that they are actually uncomfortable?
Yeah. And they'll actually hide their body or maybe even guard that or hide that body part that's painful. So maybe that wrist is painful and they've tucked it up underneath them, or they're guarding of it, or maybe they're hiding themselves. Maybe they're hiding under the bed so that they don't have to engage with any kind of, it's handling, especially that body part, or licking that body part. So the same thing, maybe that dog's wrist hurts and it's licking and licking and licking it, not just grooming, you're not that I came in from the rain licking myself dry kind of thing, but like obsessively licking that one part. And that's just a target for the dog saying, hey, this isn't right. I'm trying to make it feel normal by licking it. And that should be paid attention to as well.
Exactly. I've often had clients ask me, they had maybe surgery on their knee, the dog's knee, and they're like, oh my gosh, they're lying on it. I don't understand. Wouldn't that hurt? Right. Why are they lying on the side that they had surgery? Yep. And to your point, I think they're protecting it. And so that's indicative that it's pretty uncomfortable. When they're more willing to lie equally on both sides, then, they're more comfortable. Typically, that leg would be on the top side because they use their bottom legs to push up from. So, if it's uncomfortable, they wouldn't want to use it to push themselves up. But that just speaks to the degree of discomfort that they may be having in that leg, that they're actually hiding it and putting it on that bottom side, which makes their body mechanics more challenging.
It kind of makes sense when you go back to your point about them being pack animals and sort of being able to hide that pain or hide the sickness or hide the illness, and just tucking up that leg. And maybe that's all part of being, the pack animal, but guarding that leg. Excuse me. Or, the one of the obvious signs too is not only guarding, but maybe even trembling. So trembling, I'm panting, may also be an indication of pain.
I've seen that a lot with dogs that have had some spinal issues, for example, like disc disease, or, it's a disc that's in the process of herniating. Maybe there aren't the extreme physical signs that we can see yet, but maybe the owner comes home from work and they notice that, the dog is panting, and, they go to touch it or pick it up and it's trembling, and they're like, oh my gosh, what is going on? And, it's not that they're cold and trembling. It's that's one of the signs of pain. And that's I think a pretty extreme pain.
Yeah. And the, that makes me think of dogs and their body posture as well. So, that kind of pain you may notice it in the way the dogs are standing, right? So dogs that have pain are going to have that hunched up abdomen, that roaching of the back, tucked up abdomen, head down, maybe their eyes are closed, but they look like they're uncomfortable, right? It's not a normal body posture.
And maybe we could talk a little bit when we're talking about posture and positioning, kind of the difference between generalized pain or pain that may be emanating from like their abdomen or their back versus a limb kind of pain.
Right.
To that point, I've had a lot of owners, their dog comes into the clinic and they're limping, they're lame, they're not using that leg, but they'll say, I don't really think that they're in a lot of pain. They're not crying out, they're not, but they won't use that leg. And I think that disuse is typically indicative of pain. Mm-hmm. So when they have more of a generalized visceral pain, like you were saying, Kathy, it could be, kind of that tenseness. Like even when you touch them, their body feels tense. There's a lot of turgor. They're hunched up. They have that sour look on their face. If it's a more localized pain in an extremity, one of their paws, their legs, then it could be more that they're offloading or lifting that leg up, shifting their weight. It could even be a subtle limp, and how they're shifting off of it. Oftentimes seen, I think, when they're standing, where are they putting their weight? Because they'll take that time to rest the injured part, and it may not even be so obvious when they're walking or playing, but when they're standing, are they shifting that weight off of a painful limb?
Right. As a technician, one of the things I think about, not only for dogs with generalized pain or abdominal pain or orthopedic pain or pain in their limbs or joints, is mouth pain. And mouth pain is often, it's often overlooked. And dogs get mouth pain just like people do. So dogs get cavities, dogs get abscesses, dogs get cracked teeth.
Oral cancer.
Oh gosh, and oral cancer. So I know it's a hassle when they come in and we go, it's time for dentistry. But the dentistry allows us for many things, not only cleaning the teeth and checking the gums and stuff, but to check your dog's mouth for things like cracked teeth, abscesses, lesions, things that might be causing them pain.
So how do we know? How do we know that this is occurring?
It's a good question, Chris. Actually, sometimes people will come in and go, oh, my dog's doing great, but she's drooling. Or she's doing great, but, she's not eating as much as she used to. She's still active, but doesn't want to eat. Or, they pick that food up in their mouth and they get it in their mouth and and they drop it. And then the other thing is, sometimes odor is actually an indicator of infection or mouth pain or disease. So all of those things should be taken into consideration, but we shouldn't discount the possibility that our dogs might have pain elsewhere besides abdomen or knee or wrist, but potentially in their mouth.
Even ears, right?
Or ears. Yeah. Ear pain is the worst. Oh my God. If you're trying to clean the ear of a dog that's got an ear pain, it's the worst. So we need to consider the fact that they may have pain in other places, and maybe they're not outwardly showing you that they have mouth pain by crying or hiding, but maybe they're drooling. Maybe they're not eating as much. Maybe they're not picking up that food and dropping it, or maybe there's some foul odor that's coming from their mouth,
or their ears, foul odor
or
from
their ears,
and
right?
shaking their head,
and again, those things are quite painful. I mean, I had an infected tooth last year. I had to have it pulled. Oh, that pain was an 11, Chris. It was the worst. I was going to die. And dogs can experience that too. So ears, mouth, abdomen, limbs, things like that. So we need to take all those into account.
I wanted that many times owners will come in and maybe their dog has been diagnosed with something, for example, arthritis, or they've had a recent surgery, and the dog isn't acting as normally as it had in the past. So they might be more lethargic. They might not be eating as well. And I think it's instinctive for us to just gravitate to that known quantity, right? Well, their arthritis must be flaring up, or, they're having more discomfort from their surgery, but we often don't explore things that haven't been brought to our attention. So, for example, the mouth pain or the ear pain, or I've had many times where a dog has an unknown urinary tract infection. And, that can be quite painful as well. And they may not be having obvious signs, but it's uncomfortable, but we attribute it to those things that we've been addressing historically. So it's always worth mentioning some of these out of the box things that you want to eliminate as potential causes for discomfort.
And this is why it is so important for you to go to your annual veterinary appointment, right? So that we can head these things off. The veterinarians can look in their ears, they can look in their mouth, they can pick up their limbs, check their range of motion, palpate their abdomen. And if you have a senior dog, I think you should go 2 times a year just to make sure that we can catch anything ahead of time, right? So this is why it's important to go to your physical exam every year so that we can catch these things before they become problematic. The other thing I was thinking, when you're there with your vet, I think it's a good idea. You can ask your vet or your technician. I think it's a good idea for owners to know what their dog's resting heart rate is, because dogs that have pain will have increased heart rate, right? They'll have an increased heart rate, and sometimes they'll also have an elevated respiration rate. And we can get our dog's resting heart rate. It's really simple to get. Your technician can show you how to do it. depending on the size of your dog, anywhere can, normal range could be anywhere from maybe 60 to, 100 or maybe even 140, depending on what kind of size dog you have. But if you understand how to take your dog's heart rate, then when you call the vet with information, you could say, well, my dog is panting. She's got a grimaced face and her heart rate's, 170. And then that's all really good information for us. We go, definitely that dog seems like there's something wrong. The dog's painful. But it's really easy to do. And your veterinarian can show you how to do it at home. Really simple.
And you get a gold star for knowing how to take your dog's heart rate.
And if you called and told me that your dog had a grimacing face, was lethargic, and had a heart rate of 180, I would be like, whoa, that lady knows her stuff. But important information, very important information for us to know, what our dog's resting heart rate is. Your dog's resting, they should have a nice, good, heart rate between, what did I say, between 60 and 140. But when it gets up high, then you start worrying about, is the dog having pain?
Mm-hmm, mm-hmm. Yep, good point. What about our cat friends? Are there signs that owners can look for in our cat friends to know that they might be uncomfortable?
Cats I'm pretty sure they're from another planet. I'm pretty sure that they're from another planet.
If dogs are good at hiding pain, cats are geniuses.
And let me tell you, if cats do come from another planet, it is a superior planet. Okay, not a lesser planet, a superior planet.
Many times I've heard stories like, literally the cat is almost dying and you wouldn't know. I mean, they're so good at masking their discomfort.
They really are. They really, really are. And I think the first thing that I think that clients notice is that the cat stopped grooming. I think that would probably be maybe one of the first indicators. And you can tell when a cat comes in and they don't feel well and they haven't been grooming, they actually look like they're sort of, like they haven't been
unkept.
They're unkept, right? And so I think that that's a good indication for cats that pain. Again, cat mouths, make sure, it's hard. They got little tiny mouths. They got little tiny teeth. It's hard to look in there. But again, the drooling, the not eating, picking up food and then maybe dropping it again might be an indication. Cats can be vocal when they're painful as well. They can howl when they're vocal. They'll meow when they're not, feeling well. It's all in part how they communicate with you as well as by letting you know with their vocalizations how they're feeling. You come home and that cat's like, hi. But if you come home and the cat's like,
right. And I think it all goes back to kind of that change in behavior again.
Right. The change in behavior.
Yeah, cats sleep a lot. And so forth. And maybe you've always been able to pick them up, but there's a change. So, maybe your cat always greeted you at the door despite having slept 23 of the 24 hours a day, but then you notice they're not greeting you at the door. Yeah. Or they typically would jump up into the windowsill to take a nap. Yeah. And they're not anymore. So is it uncomfortable for them to jump up there? I think we don't think about arthritis in our cats, and it's a very common phenomenon. The other thing is, maybe that they always allow you to pick them up, and now, like you said, they howl or they tense up or they don't want to be picked up. They run away. They jump out of your arms right away, so they're uncomfortable with being held, and they weren't before. I mean, some cats always are uncomfortable. Yeah. So that's why we have to say,
sometimes it's just a statement about how they feel about you.
Exactly. But it's a change. It's a change. And a trend too, it's not just an isolated incident, but it's happening repeatedly. So
the thing that I find that interesting that you said is that sometimes we overlook these orthopedic things in cats. And I believe that that's really true. We don't always think about our cats' arthritis. We think about our dogs and their arthritis, but cats get arthritis. We also don't think about cats and their soft tissue injury. It's probably an underdiagnosed thing. Cats can also injure themselves. They can strain, they can sprain, they can pull. And we maybe don't think about that because they're so athletic and so good at masking these things. But we really should, if there's change in behavior, they don't jump in the windowsill, they're not greeting you, they're not eating, they're not grooming, they're vocalizing when they don't normally. Those are all indications to bring to your veterinarian. And those are all indications. Did you know that birds also, we have a little bit of a way of telling when our pet birds are not feeling well too?
Do tell.
I know. We call it sick bird syndrome. When birds aren't feeling well, because birds are brilliant at masking injury, pain, and illness as well. And understandably so, they're part of a flock. And if you get sort of picked out of the flock, you could be killed, right? You could be injured or killed or whatever. But birds that aren't feeling well, oftentimes they'll be fluffed up. They'll be really fluffed up. Their eyes will be half closed. They'll oftentimes sit one leg hunched down on one leg in their cage. And they look kind of sleepy and they're not active or vocal or maybe eating. So, when we think about pain for any of our pets, anytime that behavior is outside the norm, we should report that. Could be pain. Maybe it's something else, but we should report it.
Do you know why they do the fluff up?
I think they're trying to keep themselves a little bit warm. I think they're trying to warm up because they don't feel good. But they'll really fluff up. I mean, and sometimes birds will fluff up periodically throughout the day, like when they're sleepy, or when they're grooming or preening. But this is a consistent, I'm sitting still in one spot, fluffed up, my eyes are kind of closing, and they're not active like they normally would. But, anybody can, all those animals, all of our pets can experience pain. So we just keep an eye on what is the norm and what's not the norm,
Right. So let's talk about some things that our pet owners can do at home if they think that their pets are having some discomfort or pain.
I think that the first thing I would do, as I said before, is, if I think my dog or my cat or my bird's in pain, I'm going to call the veterinarian right away.
Absolutely.
Because they're going to call it right away. And the veterinarian is going to may very well prescribe medication for your dog, maybe a non-steroidal anti-inflammatory, maybe a pain medication. But it's important to remember as an owner, never give your pet your own medications, and never give your pet your other pet's medications as well. It's got to be prescribed by your veterinarian. We've got to make sure that we have the appropriate drug, the appropriate dose, and used in the appropriate time frame, right?
Mm-hmm.
So it's really important that we not just self-prescribe medications for a dog. So that's only for your veterinarian, okay? And we want to use them as your veterinarian prescribed. But Chris, I think you had a good point the last time we talked about icing and heating. Can you talk a little bit about RICE in people?
I can. So RICE is an acronym that stands for Rest, Ice, Compression, Elevation. And it's what you do for an acute injury. And an acute injury can be on top of a chronic injury. So it may be, again, that you just stepped on Fluffy's right paw. And so he yelped, it hurts, and what are you going to do about that? Or it could be, that your pet has had chronic arthritis in their right knee, and it's been going on for years, and you've addressed it, but they were out in the yard, and you saw them step in a hole, and they come up lame on that leg. Well, that would be an acute on chronic. So whenever you have something more acutely, you typically want to rest immediately, but not forever, because typically movement is good over time. And we want to mitigate any inflammation that's going on. So that rest for a short period of time, it may be 24 hours, it may be a week, but you also concurrently want to apply some ice or cryotherapy. Bags of frozen peas work really well because they're conforming. So the next component would be compression. Compression is hard to do in a pet because we don't want to wrap something tightly and create a tourniquet effect. So I typically skip that one in our animal friends. But elevation can certainly be done. So again, if they're resting and you know that they hurt that leg, you can slip a pillow under it, just elevate it higher than their heart and help to decrease some of the swelling and so forth. And while we apply ice in the early stages of something as chronic, we can, after about 24, 48 hours, we can switch over to heat. And so again, a very mild heating that helps to increase blood flow, bring nutrients into the area, flush out waste products, and help to mitigate any pain that's happening on a more chronic basis.
Well, I was listening to talk about, massaging, and that made me think, of course, one of the things that I would tell you to do for sure if your dog has some kind of injury, acute pain, or even chronic or subchronic pain is rehabilitation, of course, physical rehabilitation. And there are a lot of things that we can do in rehab that are going to help control that inflammation, because uncontrolled inflammation, that's the enemy. That's where I'm at. Would you agree, Chris?
Absolutely.
Uncontrolled.
And pain is just one component of 5 within inflammation. So
we're going to talk about that too. Let me go over some of the adjuncts that you can use with physical therapy, and then I would really love to hear you explain the 5 of the inflammation.
Sure.
I'd like to hear that. I think there are a lot of things we can do in rehab. I mean, we have laser therapy, which is, in my opinion, has been very effective for helping patients with pain, and post-op surgery as well. I use them all the time, post-op surgery, a laser their incisions. I'll laser their mouth after extractions, dogs with osteoarthritis or even acute injuries. So I'm a big fan of the laser therapy. And I'll also use, in conjunction with rehab, acupuncture and chiropractic. I think it's a perfect marriage, really. They rehab, chiropractic, acupuncture marriage. I think that they complement each other very well. And I think the only thing I would say about that is make sure if you're going to use an acupuncturist or chiropractor that you include your veterinarian in this process of finding one. Make sure that we have somebody who knows what they're doing, who knows how to work with animals and has been licensed to work with animals. But I think they make a wonderful adjunct to, traditional, maybe Western thoughts of medicine.
Agreed. I also think that, you mentioned massage, and there are certified massage practitioners out there. And sometimes I think people think, well, my pet's hurting, so, I don't want to touch them. I don't want to, make their pain worse. Well, first of all, your dog or cat will tell you before you're ever going to touch them to the point that it's that uncomfortable. But you also think about when you stub your toe, right? And yeah, so after you swear and you're hopping up and down, what's the first thing you do? You grab your foot, you grab your toe, and you start rubbing it. Right. So definitely in those acute phases, that's telling us, geez, it feels better to rub it. It helps to, again, diminish that pain and discomfort. And then, think about that chronic knot that we've all had in our shoulder or our back. What do you want to do? You want to try to get back there. You want to rub it. And so our pets are the same way. And if you can seek out a professional that knows exactly what they're doing, they'll help you to identify where the source of the heat is where the source of the pain is actually coming from.
I'll tell you this, that when I'm treating patients at our rehab center, and I'm making them do things like get on the underwater treadmill and maybe get on the therapy ball and doing their stretching, they leave me in a hot second for the massage therapist. They drop me like a hot potato. They're like, peace out. I want to be with her, right? So much like we can enjoy that manipulation of the tissues, dogs can as well, and so can cats as well. So again, I think we just need to seek out who's the professional, somebody your veterinarian works with, somebody who's trained. Chris, I want you to go back to the inflammation. Can you talk more about that? I'm intrigued by your...
Yeah, so there are 5 components of inflammation, and those are pain, first and foremost, swelling, heat, redness, and loss of function. So if you notice that, there is swelling in an area, there's undoubtedly going to be concurrent pain in that area too, because the tissue is changed and it's putting pressure on these pain receptors through the swelling, and that makes it hurt. There's also the redness or heat, and sometimes it's hard to feel that, but if you use the back of your hand, oftentimes that's much more sensitive to identify areas of warmth that are warmer than the surrounding tissues, or maybe it's warmer on one side versus the other side. So it's a comparison kind of thing. And then the redness may not be overt. First of all, you can't see it because your dog has hair or fur, but that redness may be actually deep inside in the angry tissue. So Kathy and I have had the luxury of seeing like arthroscopes and things like that, where they're actually taking a camera and going inside a joint, for example. And it's amazing how red that tissue is. And they'll do a comparison to a normal knee, for example. And it's amazing at how angry and painful in turn that tissue.
Angry, so angry. And it's amazing when you get to see it in real time, in real life, how angry that tissue can get.
Right. And then the loss of function may be what I was referring to before, that limping, the lameness, the inability to jump. Maybe your pet's always jumped in the back of the SUV and now they can no longer do so because it hurts. They may not scream out. They don't have any other way of telling you, but they're hesitating, right? They're kind of amping up, they're pacing, they're going back and forth. They don't want to do it. That's a loss of function. Or maybe they're not able to bend the knee or something like that, like to the ability that they've done in the past. So they've lost some motion. They've lost some function there. It makes it difficult to sit if they can't fully bend their knee underneath them. So those are some examples of the components of inflammation.
I have a question, and it may seem silly, right? But and I don't want to. I'm not trying not to offend anybody out there who has a northern breed dog. Okay. But I tend to notice that that the emotional responses to pain and swelling or inflammation like that seems to be different from breed to breed, right? So your dogs that are maybe your northern breeds, like your huskies, very vocal. Shiba Inus, oh my gosh. And I'm not making fun of anybody because I have pugs, right? So even a nail trim is.
Oh, that's a thing with pugs.
It's the equivalent of having your foot amputated, right? That level of drama. But then you have other breeds like your Labradors who are just like, I mean, I've seen Labradors come in with wounds that are just like a skin flap, and they're like, "Hey, everyone, what's up? Cookies." And
the
they don't
beautiful
seem to be,
lab, right? The
right,
beautiful
right,
lab.
exactly.
Great for kids because they take it, and
exactly. And that's probably one of the reasons they're one of the most popular breeds. Is they're just like whatever, right? And they say whatever. I'm sure that they probably would say.
In their mind, yes, I know that. Yep.
But there does seem to be this disproportionate, or this weird sort of, your northern breeds are more dramatic in expressing their discomfort and their pain or potential pain, versus maybe your labs or your goldens who seem to be oblivious maybe to this type of pain. Can you speak on that?
Well,
do you have any thoughts?
Yes, I do. You may not be aware of this, but in the people world, it is well known and documented that the gingers, so the red-haired, fair-skinned, freckled folks, tend to have a lower pain tolerance, increased, as you say, emotional response to pain. And I think that the northern breeds are similar. What do you think about that?
Interesting. It's very interesting, and it would explain a lot, actually. Sorry, northern dog breed people. I'm not making fun of you.
And sorry, gingers. Yeah.
Exactly. And sorry. And again, I have pugs, so I understand what it's like to have a dog that's, emotionally dramatic about. Well, my dog's emotionally dramatic about everything, but I mean, if a dewdrop hits him, he could be emotionally damaged, right? And I understand that, but that's a very interesting topic to me, that these dogs, I mean, and huskies are no wimps. They pull these sleds on the Iditarod for miles. This is a breed that's a very hardy breed, and yet very emotional about expressing pain.
Yeah. And, one other thing I want to talk about too is, we often don't think about pain in our younger pets. And one thing that really stuck with me early on in my career is that I read a study that said that 80% of dogs have some form of arthritis by age 2.
Wow.
Now, this may not be manifested clinically. They may not be showing signs of pain. They're not limping. They're still active. They're doing everything that they want to do and that we ask them to do. But simply there's some inflammation going on in one or more joints. So arthritis. Itis as a suffix on any word means inflammation of, and arth is the joint. So again, we want to practice good habits early on in age to prevent that arthritic pain from maybe manifesting so severely, occurring sooner in life and so forth. The analogy, again, that I make with people is I bet 80% of people have arthritis by the age we're 20.
Oh, I bet.
And
I bet.
And now I really have it by now that I'm old.
Certain. I'm certain of it.
Yeah. So, and arthritis is one of those things that cannot be cured. It must be managed, and pain is a component of arthritis because pain is a component of inflammation, as we said earlier.
And
so
I think that we tend to maybe think of arthritis as maybe an old person's disease or an old dog disease, but even with our seniors that have osteoarthritis, it can be, we can manage this. And I think that it's important to do it because first of all, we can help maybe negate some of those negative factors on them, as they age, modifying their environment, so on and so forth. But also we should address this because we want our dogs to age successfully. Age is not a disease. We want them to age successfully.
Age is not a disease.
It's not a disease, people. And if we want our dogs to live their best life and we want them to be comfortable and we're concerned about their quality of life, then pain needs to be addressed.
Yeah. And you said modifying their environment and modifying their activities too. But I also think that sometimes we go too far. And, I've had people say, oh, I was told that my dog had arthritis of their hips, so I've never asked them to sit again. Yeah. And they were diagnosed at age 5. Mm. And, it wasn't so severe then, but now the dog can't sit. So, I think that being, proactive, but not so limiting that they lose some of that function. We need to maintain that strength and so on and so forth as well. So again, consult your local professional.
Yeah. And that makes me think of how we respond to our dogs. Our own reaction may impact our dog's emotional response. Does that make sense? Mm-hmm. Like if my dog is blind and he bumps into stuff, and what I had to learn from my dog is that every time he bumps into something, I shouldn't go, "Oh my God," right? Because then he goes, "Oh my God, what just happened?" Mm-hmm. You're tense. There's something to be tense about. And so I try to, certainly I check to make sure he's not injured. I certainly always check to make sure he's not injured. But on the other level for him, if he bumps into stuff, I go, "You're okay. Let's go mm-hmm. do this. Let's go do that." Because if, my emotional state really translates to my dog's emotional state. If I get tense, he thinks there's something to be tense about. If I'm upset, he believes there's something to be upset about. Maybe if I gasp, maybe he thinks he did something bad or wrong. His life is that he's periodically going to bump into stuff, and to have a response that's like, "You're okay."
Good job.
Good job. You're okay.
No
and
problem.
Maybe not overreacting to that. So I think even our own, because people, I'm going to make a bold statement here. Your dog is an emotional barometer. Okay.
Nice.
And whatever you're experiencing or feeling, it really translates to them. So if you're feeling helpless, that translates to the dog. If you're feeling anxious, that translates to your dog as well.
Right. And I think with pain, you're kind of somewhere in the middle, right? It's like you don't want to dismiss these signs that we talked about earlier. Yeah. We need to know what our dog is experiencing because we need to equip ourselves with ways to help them to address it. And again, keeping up with that great quality of life that they should be enjoying. But on the converse side, we don't want to go to the extreme of, keeping them in a bubble. Yeah. That we're like, they can't, do anything, or, we're constantly vigilant, and, that would drive me crazy if I was a dog,
I actually had to train myself a little bit not to gasp, when those things, I had to try to train myself not to do, "Oh my God." But, and yet, I would say my dog's quality of life is, it's pretty darn good. I can't lie. It's pretty darn good.
So I think,
please do.
Sorry, I didn't mean to interrupt, but I think that, maybe wrapping up with kind of talking about the difference between, pain, which can be acute or chronic, mm-hmm. and discomfort and soreness, which that chronic pain kind of becomes, right? It can be something that you're just dealing with. So I know for me, on a daily basis, I wake up with some discomfort. It's not limiting what I'm doing, but I address it. So I have my stretches. I, try to get my exercise, go out, do my walks. I work with a personal trainer, all of these things, because I myself do have arthritis. But I'm still, again, able to do all the things that I want to do. What I'm trying to prevent later in life is suffering. And I think that that's something that our pet owners are worried about, talking about your opening statement. We never want to think that our pets are suffering. So just because they experience pain, or even pain on a chronic level, every day, frequently, a few times a year, it doesn't necessarily mean that they're suffering. Suffering is when you need to start thinking about, what do we do next in terms of, is it time?
Right.
And meaning, to let them go in peace and with dignity and so forth. But Kathy and I really want to speak to the ability to address pain and try to never have your animals suffer.
Yeah. And there are things that can happen to animals as well as people that can potentially cause unmanaged, unrelenting, or pain that can't be treated, because we can manage pain, but we can't stop all pain. We can't stop all pain. Does that make sense?
That's the reality.
We cannot stop all pain.
And pain is important.
Unmanageable or unrelenting, or untreatable.
Right.
Pain is important because it lets you know
when there's
wrong,
danger.
So
yeah.
Exactly. So it's important. But if those things start happening, if your dog is having pain that can't be managed, that's the time to talk to your veterinarian. And what I suggest to people do is I tell people, if their dog has pain, keep a pain journal. and simply, you can just write down a few things in your pain journal. Tuesday, comfortable all day. Tuesday night, panting. Wednesday, write down, because it's also hard to remember when you're having a good day, when your dog's having a really bad day, and just keep track of your dog's routine. Do they have pain once a week? Do they have pain at night? And it's also helpful for us in the veterinary field. We can see that your dog's up at night. Okay, well, maybe they're having pain at night. We should address that. Or maybe they're having pain in the morning because that's when they're not eating. So just keep a journal, if you think that your dog is having those kinds of symptoms.
That's a great idea. And I think it's so easy to lose track. When your dog is uncomfortable, it seems like forever. But if you're actually writing it down, it's like, oh, I look back and it's only been 4 days, but it seemed like 2 weeks to you. And, so the duration of discomfort, the frequency of discomfort, and also the, what's the word I'm looking for? How severe it is, right? So we often use a pain scale.
Yep.
And so, how do you quantify that? And it's your scale. I think, Kathy, at one point you had mentioned to me that, pain is what you think it is.
Pain is what we say. Their pain is what we say it is, because they can't tell us. So.
Right. And so there's no right or wrong in this, and even for ourselves. So 0, no pain. 10 is suffering, the most, the most acute, horrible pain that you could ever imagine. And then there's everything in between. So you can also put that in your journal based on what your perception of their pain is. Today it's a 1, tomorrow it's an 8. Why? Are there correlations? Oh yeah, they jumped out of the car when I didn't want them to and re-injured their right wrist. So now it's an 8, So again, if we kind of get a handle on this, it becomes less scary, I think, for all of us, and, helps us to be better able to cope and help our pets.
Yeah, agreed. And I think that the biggest point we can make, and we talked about it already, is that if you think your dog is having pain, you need to incorporate your veterinarian in the treatment of this. And when you talk to your veterinarian, talk to them about all the things that we talked about. Talk about the incorporation of physical therapy. Talk about medications that will be helpful for your dog. Talk about acupuncture. Talk about chiro. Bring those things up. Talk to them and let them know how your dog is doing. And I personally love the journal. As a rehab technician, I love the journal, because I can go, okay, your dog's up at night. Let's talk to the veterinarian. Your dog's up at night, not sleeping through the night, waking up early. It's very helpful for me. So I like the journal. I'm pro-journal. And we realize that all listeners out there too may not have access to all these adjunctive or ancillary, medical treatments. But again, like you said, talk to your veterinarian. They know who's in the community, who's out there that could potentially help you, and go from there. So what are your options? Yeah. Mm-hmm. All right. I think I covered everything pain. I think we covered everything pain related.
Cool beans.
Do you have anything else, Chris? You good?
I don't. Okay. Chris out.
All right. Bye.
Thank you.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook or on Instagram at Petability Podcast.
For more information about Kathy's books and living with blind dogs, please go to enableyourpet.com. Thank you, and please tune in next time.